It is really very fitting that we take up this motion to debate upon in such a country where we are all aware of the pathetic conditions of the healthcare provided by the government institutions. So, the proposition firmly believes that privatizing these facilities would enhance the human resource and hence the economy of a country. So, first of all, before I put forward the views of the proposition, I would like to brief you all of what the motion actually says. Privatization. Privatization refers to the transfer of ownership from government hands to the private hands. And healthcare provision refers to the facilities which are provided to an individual to maintain a sound health. So the motion altogether says that this house would transfer the ownership of government hospitals and dispensaries from government hands to the private hands. The policy which has been decided by the proposition says that the government would fund the medical expenses of economically deprived sections of the society. Now, what are the reasons that proposition believes that this policy shall be implemented? As stated earlier, the pathetic condition of the medical facilities provided by the government. Second, the private sector in this field is far more better than the government one. Third, the private sector is far more accountable, swift, and efficient in providing or serving the people in this field. At the same time, healthcare is a very major factor and the government plays a major role in maintaining healthcare of its citizens. So, if we take away this sector from the government would be really very relieved to focus upon other factors like defense, foreign policy, and foreign relations, which would enhance or I can say develop a nation. It is really very sorrowful to state that 27% of the deaths in India are because of the delayed or misconducted medical treatment. So, to overcome all these circumstances, the stated policy shall be implemented. Now, how will we implement the stated policy? First, we'll make different slabs stating the annual income of individuals. Second, we'll nationalize the medical insurance. Third, we'll divert the funds which have been provided to the government hospitals and dispensaries. Fourth, we'll float a tender between private companies. Fifth, we'll sublet different companies. First, medical insurance. Now, can the private medical expenses be affordable? I say yes. Even a person below the poverty line can afford these expenses. Ask me how. I say by nationalizing the medical insurance. The first question which arises after saying that medical facilities should be privatized is that of high expenses. But when we nationalize the medical insurance, we'll be able to keep a vigilant eye over the making of the bills of the expenses, and that would bring down the medical rates and would hence be affordable to each and every individual. Second, diverting the funds provided to the government hospitals and dispensaries. Now the second question which arises is really very similar to the first one. Where would the funds come from to fulfill the gap between the subsidies or the making slabs and all? These funds would come from, I'll tell you from where. When I say privatization, it means the government would give up or the government would abandon the ownership of the hospitals and the dispensaries, which results in the government stopping funding them. So the government would be left off with good amount of money which would be used here. Third, how will we distribute the money which has been stored? This will be done. The answer to this is, this will be done when we make different slabs of the annual income of individuals. When a person from a specific slab would go to a private institution to avail the services, avail the good services in fact, some amount, the specific amount which is allotted to that specific slab from which the individual comes would be paid by the government from where for which the money has been left in the previously explained thing. Now, the coming speaker from the proposition would emphasize on two more ways of implementing the stated policy. The first one would be floating a tender between private companies. The second would be subletting different companies. I would rest my case by saying that if a country has a healthy human resource, it would have a glittering future. Thank you so much.